Christ is risen. Indeed, he is risen. I'm making this video because uh, it's kind of something dawned on me today, actually yesterday. Um, Sometimes when you do medical testing, you have to take race into an equation for various type tests or for risks. Um, Now this is an example of Saginaw VA, how they seem to only do things when it's beneficial for them. Beneficial for, and some providers, to harm the veteran. I don't. I'm not really concerned if people believe me or not. I know what I've seen. I know the stories I've told. I'm a big person of personal narrative. Hearing people's story, connecting to them. That's the future. We've drifted away from that as a church, and it's good to see we're drifting back to it. But now, African Americans, this is the realization that hit me. African Americans have a higher risk for various things like diabetes, stroke, cholesterol problems, heart problems, PAD, peripheral artery disease, anything cardiovascular, triglyceride problems, high blood pressure. And so when you add all of that together, there's some high risks for serious things like stroke, heart attack, heart failure, death. And so this is, that's my lead into, we encountered an African American gentleman at the VA, and I always meet people everywhere, and I remember their stories up here, and if they're targeted, I remember their stories. And this gentleman, the VA is telling him that his CPAP is working just fine. He's doing great. They're the same thing they say to me. And when I bring up a question, they'll try to find a way to weasel out of it or just to ignore it. But so his sleep apnea machine, he said the past 2 years, he's waking up more, just like me. We kind of, created a little commonality there because similar experience. He's waking up more, nighttime urination. He can't sleep a full. If you have apnea, you should be prepared to sleep 10 to 12 hours because your sleep is not really all that productive. Even if your apneic index, your AHI, which means it's an event, it could be partial, could be full, could be central apnea, depends what you have, or you could have one of the sides apnea. Basically, it just depends what part of your mouth, or not your mouth, this would be part of your throat is reducing oxygen flow. It could be in the middle, your tonsils or your adenoids. Could even be an epiglottis. Some people have a tendency towards swollen epiglottis. If you have any kind of gastric problem, like acid reflux, it's possible your throat could narrow and your epiglottis could swell from time to time when that acid production is high, which will inhibit your sleeping at night. And if you go to this VA and you bring up issues like that, and you go through the urgent care, there's one doctor, if he doesn't like you, he'll say that, it's in your head, yeah, it's just a sign of anxiety. He tried that with me, and I disagreed. And he, kind of insulted me, saying, so you think you're a psychologist? I'm like, yeah, actually, yes, I am. Just because I'm broke, don't judge me because I'm broke and having, a hard time because of targeting. Sound familiar? Targeting someone, singling them out, trying to mock them or diminish, their presence in the world or humiliate them. Targeting. Sound familiar? I didn't say that to him, but it's obvious. But, and I'm telling, I told him, I said, what's the pathology? He said, anxiety. I'm like, what's the pathology? I just told you anxiety. I'm like, you can't have a pathology without a measure. He's like, whoa, it's anxiety. I'm like, no, this isn't some kind of esoteric, magical, or psychic healing stuff. The problem, the critique of my field is that we don't use instrumentation enough. We just give a clinical judgment, a professional judgment. That's not science. That's opinion. But anyway, so you may have a doctor who tells you that you have anxiety. Keep pushing, because you could, if you have some kind of gastric problem, especially acid reflux, it will slowly erode your esophagus and your stomach, and then you may get into ulcers or polyps, and you don't want to mess with those. Keep pushing. If you have to, go to a different VA. Or out them, but keep in mind, hopefully you can't just become a person of faith. You have to find it, but that you may be retaliated against. This VA, they love to retaliate. They love it. They have an infrastructure where they protect people who retaliate. Which, retaliation and protection, that's actually another video later on. But that involves housing. But now, okay, so this gentleman that I met, he has, they're telling him that his CPAP is doing great. He's doing so much better. But he's telling me, like I said, increased urination, more daytime sleepiness. There's an Epworth sleepiness scale. He's actually decreasing in his, or is it increasing? Yeah, it's increasing on the Epworth scale, which means that he's more daytime somnolence, daytime sleepiness, and less wakefulness, less how can I put it? Just more drowsy and a little more easier confused, more apt to fall asleep, like sitting watching TV or even sitting in a couch or a bed reading a book. So he has more of that. His diabetes, he's having more problems with that. Again, that's another risk factor for an African American man. He has high cholesterol, he has high blood pressure, plus he's diabetic. And all of this stuff, and he's telling me he's having a harder time keeping his sugar, his A1C, keeping it down. Let's see what else he said. He said his blood pressure is more erratic. That's another side effect of being a sleep apneic. You may have blood pressure problems, which also moves into fatalities. Now, if you have sleep apnea and it's uncontrolled, or the treatment is not working, then you go into the danger of high blood pressure, stroke, heart attack, heart failure while you're sleeping. Because the body makes cholesterol at night while you're resting. So if you're not sleeping well and your blood pressure is erratic and your body's making cholesterol and you're having more of a apnea, either a hypopnea or a full apneic index, which means your throat is being covered more and your O2 is going down. That's if somebody is going to be a fatality from sleep apnea, it usually happens when they're asleep. Now, in the religious world, it's a blessing to die when you're asleep. It's kind of an honor of God. You don't suffer. But the fact of the matter is, God gives us free will. And if a doctor or some other provider was not treating your sleep apnea properly and you die, that's not a blessing. That's negligence, and that's evil done to another person. So that's the story for that gentleman, how they're ignoring his risk factor, his ethnic background. Not there's anything bad, just, certain diets, certain habits, then genetics come into play. So they're not paying attention to that at all, his risk factor. And I told him, I'm like, you need to really push them. You don't want them, because they evidently don't care. Your family needs you, and this is wrong. And he said, I'm going to try harder. I'm like, yeah, if you have to, just go to a different VA. or file a complaint. He rolled his eyes because all of us vets know what happens at this VA. The word people know what happens. I mean, it's system wide, but just this VA, they perfected it. Especially the call center. Some of the call center folks who legally don't even have recourse to use DPRS. They're subcontractors. DBRS is specifically designed, the legislation was for VA employees and for veterans. You don't see a word in there about contractors, not a word. But anyway, so then we moved to myself. Now, me being of mixed, ethnic background, I was given, how could I put it? Urine-based tests, I guess. I'm not going to go into the depths of I'm just learning some of this stuff the past couple years, some of these names of these different tests. But one of them tests for inflammation, and they use your urine, and it looks at specific gravity. If you have inflammation, certain cells in your urine, they will sink. But if you, there's an adjustment. If you are, depending on your ethnic background, there's an adjustment for that particular test. I think it's called the Westergen ESR, or maybe it's specific gravity. But anyway, for both, there's they call it the race factor calculation. Because some people have more of those fluids or more of those cells in their urine than others. And then also it determines, they don't consider this the test, but if you have high cholesterol and high triglycerides, it will affect the gravity of these particular cells in your urine. It'll affect their how far they float, because we all know, what does fat do? What does cholesterol do when it's put in liquid? It floats. So it affects the level that they sink, as well as how much they float. So it throws the test off. But they didn't consider that calculation. They don't. You got to tell them and remind them, hey, this affects this. But there is a calculation, because certain ethnic backgrounds will have variants for gravity of the urine, and gravity affecting certain cells. So when they did mine, and they did the calculation, including race and ethnic background, even though they don't even have my ethnicity correctly in there, but it just shows attention to detail is not there. But so some of these tests, with their calculations, my gravity is not that advanced for inflammatory diseases. It's kind of like low to midline. And again, this is without calculating, those, fatty type cells, triglycerides, HDL. And so it just shows that they only use the race equation when it's convenient for them. Not, being proactive for the veteran, or not being, paying attention to detail that maybe this person is ill. It's just a story from two different people, how it seems to, they only use things when it's convenient for them. And, when it comes to fatality, I mean, myself to a certain point, but that gentleman with all of those risks, and they're ignoring, something it's staring them right in the face, literally, as well as the fact that the risk factors plus the data they have, they're only looking at one part of that picture. They're ignoring the risk factors and only looking at the data. And third, they're not even listening to the patient. Not even listening to him. So that's just, kind of we'll call it buffet evidence-based medicine. Nobody likes to shop at that restaurant.